Member for Kelowna Mission.
Quote, lengthy wait times have some BC cancer patients dying before their first consultations, end quote. Honourable Speaker, these are the headlines that our province is making in newspapers such as the Globe and Mail as British Columbians face extraordinary and sometimes tragic wait times when dealing with cancer care in BC. According to the Globe and Mail investigation, only 1 in 5 patients referred to an oncologist received the first consultation within the recommended period of 2 weeks. This is unacceptable. Cancer is a ticking time bomb. In our bodies, when cancer care is delayed or inaccessible, there is a lower chance of survival, greater problems associated with treatment, and higher costs of care. We know that early diagnosis improves cancer outcomes by providing care at the earliest stage possible, and is therefore an important public health strategy in all settings. However, the failure to do so and provide timely cancer diagnosis to those with cancer in BC can be deadly. With our growing population and a healthcare system that isn't able to keep up, specialists are warning about the tsunami of cancer that is about to ensue. They are also warning that they are seeing later stage cancers in greater numbers than ever before. They have also been sounding the alarm bell that those waiting to get in to see a specialist is now in the millions. Is it really that serious? Well, the difference between life and death for cancer patients can be the time it takes for diagnosis and treatment. In a British Medical Journal article by Hannah in 2020, it was shown that for every week of delay after diagnosis, survival is shortened by 1.2 to 3.2% per week of delay. Imagine waiting 3 months. A 12-week wait time would bring down one's chance of survival by roughly 26%. But sadly, that is what British Columbians are doing right now. They're waiting months and months for treatment. This is why our outcomes keep getting worse and our wait lists longer with more lives on the line. I've been speaking with constituents who are being given these wait times. A patient given 6 months to live if not treated, and then being told that the first meeting with a specialist is going to be in 3. A woman in her 40s waiting months for minor surgery to remove cancerous tissue in her cervix, only to have it grow and then need a full hysterectomy after wait times. Another who is being told that she has to wait 2 months for radiation to even start. We need better cancer care. BC is experiencing the longest waits in Canada, and this is simply unacceptable. No other province in Canada has seen such a colossal decline in its cancer system. This decline represents a huge failure in governance and oversight. Radical change is needed, and it is needed now. Patients are being forced to wait months before their first consultation, and many don't survive much longer after losing precious time waiting for their turn. Many of these deaths would have been avoidable had the government taken the necessary steps to ensure that our cancer care wait times are actively being mitigated and addressed. These lives can be saved, and we need to make sure we give everyone the chance to fight for their right to survive. With wait times that far exceed expert recommendations, the cruel reality of waiting for cancer treatment in BC, it's only increasingly dangerous and tragic. The excuses have to stop. Radical change is required. We've heard the excuse for the increase in cases due to aging, but we were warned. And we all knew that this would happen. It could have been planned for, but it wasn't. The increase in cases is not the reason. Failure to plan for capacity in a timely manner is the issue. So what can be done? Well, we need system-wide changes. And it's not just about tweaking the edges or giving minor amounts of money. Small checks are not going to fix a broken system that this government failed to fix. It's about radical overhaul. BC Cancer delivered a 10-year cancer plan, but has yet to see it accepted or funded, and meanwhile, people die on wait lists. Let me be clear. Oncologists, radiologists, technicians, nurses, they are the heroes of this story. But BC oncologists are burning out because of the lack of resources and massive underfunding. A study recently done shows that BC is the worst for burnout in Canada. The same study showed that while they are not being consulted enough in policy decisions, the Minister of Health spoke about new positions being funded, but neglected to say or give indication that there are 18 oncologists have actually left BC because of working conditions and the lack of support that doesn't allow them to properly do their roles. Things have to change with the leadership structure and how cancer treatment is being administered. We need proactive, funded, predictive planning that will accommodate the capacity necessary to treat cancer. Clearly, it is not working. BC has fallen from first place in cancer outcomes in Canada to last place in wait times in Canada, according to the Canadian Institute for Health Information. We're moving backwards, not forwards, as cancer care quality and efficiency under the current administration is worsening. Families of cancer patients are tired, and they deserve answers. Why? Why have we gone from best to worst? Why are oncologists leaving our province? Why are patients paying the price with their lives? We can see what we can't see in the numbers that would even be worse for BC are the layered effects of waiting. Waiting to see a family doctor, waiting for imaging studies, waiting for biopsy booking, waiting for results to be reported, waiting to see an oncologist for consultation, waiting to have treatment once decision has been made to treat. The current system is placing an incredible amount of unfathomable burden on patients who are already facing the fight of their lives. This has to stop. Thank you, Mr. Speaker.